Hi, Marie. How are you?
Well, I am feeling a little bit better. I'm managing to take the lower dose of medication and more frequently, and I have less side effects, but my shortness of breath is getting worse.
I'm proud of you for taking that medication, and I can understand that you're feeling the shortness of breath. The Dilaudid, the pain medication, does help relieve the symptom of difficult breathing, but there are some other things that we can do to help make you more comfortable. We can get a fan and put it right here in the room and have it blowing on your face, and it'll make you feel more comfortable. Sometimes it's helpful to open a window or the door, and even putting a cold cloth on your forehead. That can make you feel more comfortable. So we'll give these things a try. Now, Marie, last week we talked a little bit about the progression of your disease and the symptoms that were happening with it, about you not wanting to eat and not wanting to drink, and about the disease progressing. And this disease is going to continue, and it's not going to get better, and eventually your heart will stop. This is what we expect the natural progression of your disease to be. And I need to talk to you about something. It's about calling 911. If 911 were called, the emergency services would not be able to bring you back to health. And this would be traumatic for your family. This is a time when you need your family around you. You need to feel their love, their support, and their time with you. Well, there is a tool that we have that can help you. It's called a DNRC. And that's a little form that we'll sign and we'll put it in the chart, in the nursing chart. And should 911 be called, this can be shown to them if you decide you want to do that, and they would not do any of the resuscitation procedures. Now you have to know there are times when you might need 911. So there is a role for the ambulance. Now, Marie, how are you feeling about allowing the natural progression of your disease and not calling 911 in order to resuscitate you?
Absolutely, yeah. I don't want that.
You know, Marie, you've been given some precious time. And Jake, it's good for you to know this too. This is a time when you can tell stories about yourself, stories that they may not know about you. It's also a wonderful time to share your love for each other. And there's something else I wanted to bring up. We have wonderful hospice volunteers. Having a hospice volunteer come would give Jake a break, time to go out for a walk, time to run some errands, and an important time for you to share with the volunteers. They're wonderfully trained, and sometimes you can say things that you might find uncomfortable to say with your family. So if it's all right with you, I would phone the hospice case coordinator, have her come and have a visit, and set up a volunteer for you.
Yes, that would be fine.
So I will call the case manager at CCAC and give her an update of what we talked about today. It's important for her to know that. Now I want to talk to you about something else. Not only does the one who has the disease suffer, but the one standing by your side, Jake, suffers as well. And I wondered if it would be okay with you if I had a few words with Jake on the way out.
Yes, I understand. Yeah, that would be good.
Well, I'll take my leave of you now. You've been just wonderful. I'll be back next week. You can call me if you need me. It's been good to spend time with you today. Bye-bye. Jake, I've been worried about you. How are you feeling?
I've been doing okay, but I feel totally helpless. I just can't stand to see her suffering and in pain.
You know, it's really hard when you feel like there's nothing that you can do. But you need to know how absolutely powerful your love and support is. Not only that, you're giving her a wonderful gift. You're allowing her to die at home. And that That presence of familiar surroundings, of being with you guys, is absolutely important. And even that little dog of yours running around cheers her up and makes her feel better. But Jake, I wanted to talk to you a little bit about what can happen near the end. I already mentioned to both of you about her getting sleepier. She will become unconscious and her breathing will change. And she may have some regular breathing and then it stops. And you'll even think she may be gone. And then the breathing starts again. Also, at this time, it's not uncommon to hear a gurgling sound in the back of her throat. And I have to tell you, that's very distressing. But I want to reassure you, she will not be feeling any pain. She will not be distressed. Jake, at this time, it's important to take her hand, put your mouth close to her ear. Tell her that you love her. She will sense your presence and know that you're there, and that will be reassuring to you and to her. This is often a time when families feel panicky. Don't call 911, but call your nurse. You have her number. She will come. She will help you. She will do the proper documentation about Marie's death. She will help you make arrangements with the funeral home so that they can do their part, and they will be coming to pick up Marie. And she can just be with you and comfort you during that time. It's a time that you do not have to be afraid. Jake, sometimes it can be helpful to talk with your wife about what she'd like at her funeral. Hymns, a favorite song, a reading, a poem. And it's comforting often to sit down and have a chat like that, so don't be afraid to do it. I want to tell you, Jake, you're doing a wonderful job. I know it's a struggle, but it's absolutely amazing what you're doing. And if it weren't for you, Marie wouldn't be able to have her wish to die here at home.
Thank you so much, Dr. Kelly. I don't know how we could have managed without your help.
Jake, it's our privilege to serve you and to be a part of this journey with you. I wish we could take these things away, but we can't. It's time for me to go. I'll see you next week. Bye-bye for now.